Hello, welcome to my channel, Moving Faster with Parkinson, where we discuss mostly the management of common symptoms in Parkinson's disease in an easy and simple way to understand. Our topic today is constipation. This recommendation applies to everyone with constipation, not just patients with Parkinson. Actually, the management is not too different from the general population. Let me start saying something you already know. Constipation is extremely common in the general population, but it is even more common in patients with Parkinson's disease. There are a few reasons for that. Number one, remember that in Parkinson's disease, everything moves slow, including a slow movement of the feces through the colon. Other cause is problems in the way that your muscle in the rectal area are contracting, kind of in coordination in the contraction of those muscles. The next question to answer is, do you have constipation? Well, remember that constipation is not just infrequent bowel movement, usually defined as a 3 bowel movement per week. There are many definitions, but let's keep things simple, except I need to say that also is defined as a bowel movement that requires significant amount of straining and the sensation of incomplete evacuation. These interesting graphics show the Parkinson's disease course and the symptoms. In this area of the graphic, we see the non-motor symptoms, and this area is the combination of the non-motor symptoms and the motor symptoms. When I say motor symptoms, I'm talking about the slow movement, the stiffness, and the shakiness, the tremor. So you can see that constipation can be present many years prior to the motor symptoms onset, which is here. This is the area, this is the time when we make the diagnosis, but constipation can be even 20 years before. However, if you have constipation, that doesn't mean that you are going to have Parkinson, okay? This graphic only shows that constipation can be present many years before the motor symptoms. Now, this very interesting graphic shows how common is constipation, how prevalent is constipation. So you can see constipation is approximately 60% of the patient with Parkinson's disease, they have constipation. You can compare this with fatigue, which is a more common than constipation. Almost 90% of the patient with Parkinson complain of fatigue. Now, the orange color here show the percent, the amount of patients with uncontrolled symptoms. So, which means that constipation here, approximately 30% of the patient will tell you that they are not doing well managing constipation. Very important graphic. Now, what to do? Remember, you need to do something about this because constipation might result in many things. For example, it can give you poor appetite, feeling bloating, affecting your motor function in different ways. It might cause actually leakage and accidents, also abdominal pain. So definitely you need to do something to improve your quality of life. Speak up. Now, let's talk about the most important part of this talk. What to do? What is the management? So the first step is educate yourself. You are watching this video, that's the first step. Learn more about your problem, in this case, constipation. Remember that knowledge is power, okay? However, be careful with Dr. Google. The next step is to check your medication list. Tell your doctor, usually your primary care provider will check your medication list, looking for medication that might exacerbate constipation before just blaming Parkinson's disease. For example, pills that we use to control the excessive contraction of the bladder, like for example, oxybutynin, might contribute to your constipation. So sometimes we need to change those medications. Number two, some antidepressants, for example, amitriptyline, which is a medication that we use sometimes to help you to sleep, might cause constipation. Other medications are painkillers. Painkillers such as oxycodone, Norco, tramadol, all those medications might cause constipation. Also, iron supplementation, another cause of constipation. Now, the next step is to rule out metabolic process. For example, increased levels of calcium. High levels of calcium might cause constipation. Also, making sure that you don't have low levels of your thyroid hormone, because having hypothyroidism might cause constipation. So sometimes your provider need to check the calcium levels and also what we call TSH to make sure that we are ruling out those metabolic processes prior to just blame Parkinson's disease. Now, the next step is to modify your diet. And I like to use the word modify instead of change. It, I think, sounds better, less painful, at least mentally. Now, increase your fiber diet. This is extremely important. For example, you need to eat more of this vegetable. For example, apple with the skin, prunes, broccoli, peas, spinach, kidney beans. All of these fruit and vegetable, they have high levels, high amount of fiber. Very important. Now, when you go to the supermarket, try to find, go to the cereal section and try to find this one. This cereal, it has significant amount of fiber. Very important. Also, you can, and we have actually plenty of data about probiotics. This is very important in the setting of constipation, especially with Parkinson. You can get fermented milk. You can get Activa. Very important. And again, we have plenty of data in the setting of Parkinson. Now, this is very important here. Make sure that you are hydrated. Drink enough water. Otherwise, it's not going to work. Okay, very important. Next, I typically recommend my patients, if available, to see a dietitian. Very important that you see a dietitian if available. The other factor is you need to have a regular exercise program. I have a video about this. You can check my videos. There is a video about exercises in the setting of Parkinson's disease. Watch that video. Now, very important to have a habit, make a habit. So which means wake up at the same time. So people with Parkinson, and actually in the general population, things work better when you have habit, when you have a routine, when you wake up at the same time, things will work better. You need to take your medication at the same time. Do the same thing every day. For example, exercises at the same time, or at least try, and take your medication at the same time. Now, this is very important that I would recommend this. Listen, when you wake up early in the morning, you go to the bathroom. Usually people go and urinate, take your medication. But I recommend you to take your medication with a hot coffee. You sit down, you drink your coffee, slowly read something and wait a little bit. But the key here is you need to be resting and the coffee has to be hot. So that means that you might need to warm the coffee frequently, okay? Has to be hot. And you need to be resting. You cannot be around the house walking because it's not gonna work. You need to be resting and the coffee need to be hot. This process somehow stimulate something that we call the gastrocolic reflex. It might take time, it might take minutes, it might take half hour, but the key here again is to drink the coffee hot, has to be slow, take your time, and you can be reading something, but you need to be resting, okay? Resting. Try to do that. Now, I would suggest you to try this position, okay? Many people don't know this, but this is the correct toilet sitting position, okay? That helps you, if you do this, that helps to relax the pelvic muscle, making the bowel movement easier, okay? So the key here is, the most important step here is to keep the level of your knee over the hip. You see this? That's the most important step. So, and you just try to keep your elbow on your knees and lean a little bit forward. That's the correct position to make this muscle more relaxed. Okay, very important. Try that. One way that you can keep your knees over the hip is using the step stool, like this one, probably like 3 inches, 4 inches, something like that. Everything depends, but try this. Now, if this doesn't work, then you need to try these type of fibers, okay? I would suggest first to try Citrusel, which is this one. Why? Because Citrusel is mostly insoluble fibers, which means that the probability of having more gases with this is less likely when compared when you use this one, Metamucil, because this one is very rich in soluble and insoluble fiber, which means that the probability of having more gases increase significantly. If that doesn't work, you can try what we call osmotic laxative, like Miralax. Miralax is very safe. Now, the next step is then you need to try a medication that requires prescription. I'm talking about Amitiza or Amitiza, 24 micrograms twice daily with food and water, okay? Tend to be very effective, but you need prescription for this. You need to talk with your doctor. And I would suggest after this treatment, the bulking and the osmotic laxative. If that doesn't work, then you go here. Then, this is a very important paper. This is a recommendation by the Movement Disorder Society. This paper was published in 2019. This is a group of experts in Parkinson's disease. They decided that these three types of treatment are the best based on current data, based on evidence. So you can see that probiotics and prebiotic fiber are very, very good, very effective, But also the use of microgol, which is Miralax, is also effective as well. And they recommend also possibly useful Amitiza. Okay, so that's the current recommendation by the Movement Disorder Society for constipation in the setting of Parkinson's disease. Now, final points to finish. Always tell your doctor about your symptoms, including constipation. If you don't have improvement with all of these recommendations that we discussed, you need to see the gastroenterologist. It's the GI doctor, which is an internist specialized just on that in the digestive system. Very important. Okay. Now, don't forget to like, share, and subscribe to my channel. See you soon.